People with type 1 diabetes should be checking blood sugar levels at least 4 times a day, before breakfast, before lunch, before dinner, and at bedtime before the bedtime snack. The supplies you'll need include a blood glucose meter and test strips, lancing device and lancet, and a logbook. For individuals who do not have diabetes, their blood sugar stays between 70 and 120 milligrams per deciliter. For those living with diabetes, it's not possible to maintain blood sugars in that narrow range. Your care team will provide your ideal range. The goal will be to maintain your blood sugar in that target range about 3/4 of the time. The American Diabetes Association recommends a target blood sugar level for children between 90 and 130 before meals and 90 and 150 at bedtime and overnight. Once again, you'll test your blood sugars at least 4 times per day, before your 3 meals and before your bedtime snack. Even if you're not having a bedtime snack, make sure you test about 2 to 4 hours after eating dinner. It is important not to skip any of these testing times, as each of them provides important information that you and your care team will use to determine how your diabetes care plan is working and to make any necessary adjustments. Record all glucose tests in your logbook, along with insulin doses, how many carbs you've eaten, and your activity levels. This information is also very important in evaluating how your plan is working. If your blood sugar is not in your target range and you know why or think you know why, make a note of that as well. This could include things such as being more or less active or eating out and not having the exact carbohydrate counts for some foods. Develop a routine for reviewing your blood sugar patterns about once a week. If the numbers are not in your target range at least 3/4 of the time, you should contact your care team to discuss changes to your plan. The brand of your blood glucose meter is determined by health insurance coverage. Your care team will show you how to use your specific meter. No matter which type of meter you use, you must wash your hands prior to testing, not only to minimize germs, but also to remove any sugar that may be on your fingers. Any microscopic sugar on your fingers could mix with the drop of blood and result in a false high result, so always wash and dry your hands thoroughly before testing. Alcohol may be used if there's not a sink available, but in that case, it's recommended to wipe away the first drop of blood to decrease the possibility of alcohol mixing with that drop of blood. Then use the second drop of blood for your test. These links can be helpful to review the use of your specific type of meter. Along with reviewing your blood sugar logbook to make sure that you're in the desired target range, you'll also have a lab test every 3 months. This is called a Hemoglobin A1c. This test indicates what your average blood sugar has been for about the last 3 months. The A1c goal for all youth is less than 7.5%. Think of the A1c like a batting average. Even though each individual game is important, the average tells you how well you're doing overall.